By the name of Allah, the most gracious, the most merciful. Dear second year ISP students, welcome again in another lesson of medical English. Your teacher Youcef going to explain today a little bit a practical side of a nurse work. So we have first to remember what we have seen last time. In the previous course, we have dealt with the 8 important speech parts, which are nouns, pronouns, adjectives, adverbs, and we have seen the use of each one of them. Today, as I have mentioned, we will see the practical part of a nurse during a hospital. First, what is acting in hospital? And we will see what is the exact role of a nurse. A nurse is a person who is trained to give care to people who are sick or injured. Nurses work with doctors and other healthcare workers to make patients well and to keep them fit and healthy. Nurses also help with end-of-life needs to assist other family members with grieving. So here we are explaining the role of the nurse. Nurse must be everywhere, besides their patient, besides their family, and explaining or giving a clear image about the patients. In this chapter, inshallah, we will see greeting, reassuring, and the room, meals, and giving patients information. So, what is giving an order? A nurse obviously is always in need to give an order either to the patients or their family members or their team workers. You have to say, take this medication. So here, the nurse is asking the patient to take his medication. Or, you must take this medication. So here the difference is in the degree of obligation. When we use the module must, we are emphasize the meaning or asking the patient to take his medication. We will move to giving an advice. For giving an advice, we have to use the module should or can. You should take this medication, or you can take this medication. So only the difference here between an order and an advice is in the degree of emphasizing. In giving advice, the nurse is not obligating the nurse or the patient, to take his medication. So, asking for permission. Can I open this window? May I open this window? We will also see asking a patient to do something, or it's the same with giving an order. Can you show me your arm? Explain what to do. I'm going to take your temperature. Would you like to come with me to the X-ray room, please? So here the nurse is asking the patient to go with him to the X-ray rooms to have some analysis. So we will see also greeting and salutation and patient care. Starting by patient care. This is a dialogue between a nurse and a patient to take care of him, obviously to take care of the patient. So the nurse starts the conversation. Hello, Mr. Duke. I am your nurse. My name is Tom. How are you feeling today? So here we are asking about the state of the patient. The patient answers, I am feeling terrible or awful. Not too bad. The nurse, I am sorry to hear that. So the nurse is sorry because he is sad about the state of the patient. And the patient answers in another different form, I'm okay, I'm better, or I am fine, or I'm great. So the nurse situation here changed a little bit, and it will be, I am happy to hear that, or I am glad to hear that. The patient is talking too fast, and the nurse cannot understand what he is saying. So the nurse said, I'm sorry, I don't understand. Can you speak more slowly? Can you repeat, please? Thank you. So here, the nurse is asking the patient to repeat what he said because he doesn't understand. So, reassuring. Reassurance is the removal of fears and concerns about illness. In practice, reassurance for non-specific conditions where a diagnosis is unclear or unavailable. It is difficult and can have unexpected effects. Many clinical guidelines for non-specific conditions, such as low back pain, recommend reassurance. Until recently, there was little evidence on how to reassure patients effectively. So the role of the nurse here is to reassure his patients and reduce the fears of the patients or his fears. Here we will see what are the results of reassuring. High distress causes patients to consult more often for low back pain. To reduce distress, clinicians should provide structured education, which is effective in the short and long term. A newly developed online prognostic tool has the potential to improve the quality of reassurance and reduce the number of inappropriate interventions provided for low back pain. So here we give an example about a patient who is suffering from a back pain. So the nurse here is trying to reduce the fear of the patient and giving some optimistic observation to the patient. Reassuring example. We will see here a dialogue about reassuring. So the nurse starts as usual. Hello, Mr. Duke. How are you feeling today? The patient answers, not very well. The nurse, what's the matter? The patient answered, I am scared, or I am in pain, I miss my family, I want to go home. The nurse replies, I understand, but don't worry, we will take good care of you. You are in good hands here. Let's help you first, okay? So the nurse is trying to not making the patient worry. By talking like that way, he is helping him to avoid this stress. We are doing our best, but you must be patient and everything will be okay. Keep your spirits up. We will see the role of the nurse in the patient's room. The patient room is the smallest cell of the hospital organism. Its layer determines the structure of the ward and is therefore a decisive factor for the entire building. So the patient's room plays an important role in treating the patient. It helps him to avoid stress and get healthy again. Many requirements have to be met. So here we are talking about the requirements that should exist in the patient's room. The patient's sense of well-being can be positively influenced by the design. Homely materials, an attractive view, and sufficient privacy are important objectives. So here are the three main elements that must be found in the patient's room. Homely materials for the patient to feel like he's in his house, an attractive view, and the sufficient privacy. Equally important are the working conditions for the staff, especially short distance and a sufficient care routine. Finally, even the risk of infection can be reduced by conscientiously planned room layout. So, here is another dialogue. A nurse, I am going to explain a few things about your room. So here the dialogue is about the patient's room. This is the nurse call button. You can use it to call a nurse. This is a remote to adjust the bed. This is a closet safe box to put your personal belongings. This is your bedroom, or your bathroom, sorry. This is a drip pole. You must take it with you if you get up. Visiting hours are from 8 o'clock, for example, to 12 o'clock. So here, the nurse is explaining all what is concerned with the room and the times of visiting. So, the nurse role here is to give a view or an image about all what should the patient know. The meals. Hospital services, a 24/7 department in a hospital that provides for the nutritional needs of patients, those needing special diets, preparing meals and transporting them to the floor, and through the cafeteria, the hospital staff and visitors. Meals and nurses' role. So here another dialogue to show us the role of nurses serving the patient with meals. Meal times are from, and we precise the time, for breakfast, either, or lunch, or dinner. Is there anything you don't eat? Do you need a salt-free diet, sugar-free diet? So here the nurse is precising the type of the food concerning any patient, and he is deciding whether the patient eats something or no. So, we will move and see what are patient's information or how to take them. Patient information includes a range of different data types, such as patient's medical history, medical test results, and insurance information. Healthcare professionals can use all of this data to provide better care for their patients. So the nurse, while giving and information about the patient. It will make the process easier for the rest team or for doctors or other nurses. Communicating with patients. The first step is to find out what the patient already knows. Use these guidelines to do a thorough assessment before starting patient education. So, first the nurse must gather the clues. Talk to the healthcare team members and observe the patient. Be careful not to make assumptions. Patient teaching based on incorrect assumption may not be very effective and may take more time. Find out what the patient wants to know or take away from your meeting. The second element is get to know your patient. So, you have to introduce yourself and explain your role in your patient's care. Review their medical record and ask basic get to know you questions. The third element is establishing a rapport. Make eye contact when appropriate and help your patient feel comfortable with you. Pay attention to the person concerned. Sit down near to the patient. The fourth element is gain trust. So, obviously, the nurse must gain the trust of his patients. Show respect and treat each person with compassion and without judgment. The fifth element, determine your patient's readiness to learn. Ask your patients about their outlooks, attitudes, and motivation. Learn the patient's perspective. Talk to the patient about worries, fears, and possible misconceptions. The information you receive can help guide your patient teaching. Ask the right question, and here maybe it's the important element. Ask if the patient has concerns, not just questions. Use open-ended questions that require the patient to reveal more detail. Listen carefully. The patient's answer will help you to learn the person's core beliefs. This will help you understand the patient's motivation and let you know or let you plan the best way to teach. Learn about patient skills. Find out what your patient already knows. You may want to use the teach-back method, also called the show-me method, and this is a method between the patient and the nurse which is based on each member of the conversation must tell the other part everything about his life to figure out what the patient may have learned from other providers. Involve others. Ask if the patient wants to other people involved with care process. It is possible that the person who volunteers to be involved in your patient's care may not be the person your patient prefers to be with. Learn about the support available to your patient. So here, when we involve other people, we are not obliged to involve other teammates or other person we know. We first must ask the patient about any person he would like to join during the therapy or during the treatment. Take time to establish rapport, and we will see later how to establish a rapport. Do a comprehensive assessment. It is worth it because your patient education efforts will be more effective. So today we have finished our lesson. See you next time inshallah. I hope that you have enjoyed. See you again.